My name is Brian Gardom, and I'm a patient advocate, and I suppose you'd say a trainee trustee for CLLSA, which means I've not been appointed yet, but I've gone through the interview process. Now, when we become a patient, we also become the center of a small network of concerned people. I'd like to talk to you this afternoon about building good relationships with your GP and your consultant, and hopefully impress on you how important this link can be. Those of us old enough to remember a singer-comedian called Max Bygraves will recall his irritating catchphrase, "I want to tell you a story." Well, I'd like to tell you a story. This story begins one morning a few years ago when my wife Tricia woke up feeling unwell. In truth, she'd been under the weather for a few days, but you know CLL, you can have good days and bad days. This, however, felt different. She had a severe headache and her temperature had been rising slowly for a day or so. At around 11 o'clock in the morning, we called the GP. Now, the first thing you have to do is to get past the gatekeeper, otherwise known as the receptionist. Their main purpose often seems to be to protect the doctor at all costs from having to deal with patients. However, we'd got to know the receptionists well. There were 3 of them, and we built a good relationship. We got to know them by name, when their birthdays were. We always gave them a card, and we gave them a box of chocolate at Christmas. We also spent time educating them about CLL and the problems that can occur with a compromised immune system. So when we called, the receptionist on duty, who was Carol on that day, recognized us immediately. And we were put through straight away to the doctor, who happened to be with a patient at the time, but still took the call. Now, we'd selected this GP in particular because he was the head of practice. And we also spent time educating him about CLL. He'd only had one previous patient with CLL several years previously and couldn't really remember very much about the disease. We supplied him with booklets and leaflets, and he became, over time, very interested in the latest research and always inquired about new developments whenever we saw him. Incidentally, we also had a backup GP in the same practice in case we couldn't get hold of our first choice. And we also took him through a similar learning process. Always have a plan B. The GP on this occasion decided he didn't really like the sound of the symptoms and told us to pack a bag immediately. We always kept 2 overnight bags ready just in case. Having got rid of his patient, the GP telephoned Tricia's consultant. Now, we'd provided the GP during his education with a list of telephone numbers, including a direct line to the consultant, the emergency hematology number, and the number of the specialist nurse. The consultant was on his ward rounds, but still took the call. Within a few minutes, he'd called us back to discuss the symptoms. He agreed with the GP that there could be a problem and told us to come into the hospital as soon as possible. We were about an hour and a quarter from the hospital, but while we were on our way, the consultant located an isolation room, had it inspected, thoroughly cleaned, and it was ready by the time we arrived. When we arrived, we went directly to the hematology ward where the staff were already waiting. By now, my wife was beginning to feel very unwell, and she had what seemed to be some kind of a gentle seizure whilst in the triage suite. The consultant soon arrived and asked my wife, "Do you know where we are?" "Yes," she replied firmly. "And so, where are you?" She looked puzzled and said, hard question. "Do you know who this is?" he asked, pointing to me. "Yes." "So who is it?" A big sigh a deeply puzzled expression, and no reply. She was clearly going into some sort of coma. The team reacted immediately, and within a few moments, we were in the isolation room, and 2 drips were being inserted, one a strong antibiotic, the other a strong antiviral. The team, by now suited up in masks and gloves and plastic gowns, were not sure what was causing the problem, but had to take a belt and braces approach, hence the 2 drips. Tricia was unconscious for 2 days, was monitored initially every 30 minutes, day and night. I was allowed to stay in the room throughout. My goodness me, I can tell you those hospital chairs are very uncomfortable. The kind nurses eventually took pity on me and found a camp bed. But trying to rest with nurses coming in every 30 minutes is pretty impossible. On the 3rd day, Tricia woke up and started to speak. Strangely garbled at first, but gradually more coherent. On day 4, she could sit up, and by day 5, she was beginning to eat more or less normally. We were in that isolation room for 10 days, and then we were allowed home. Overall, quite an experience, and not one to be repeated. The diagnosis was eventually established as probably viral meningitis. And it is critical that even in non-immune compromised people, it must be treated without delay. You can never be sure, but it was thought that had we delayed by even more than an hour, the results could easily have been very different. The time lapse between calling the GP and Tricia receiving treatment was amazingly about 4 hours, and that included an hour's journey. And this, I'm quite certain, was only achieved because of the groundwork we'd been able to do during Watch and Wait. Together, of course, with the wonderful response of everyone involved along the line. Now, one of Max Bygrave's hit songs, now thankfully long forgotten, had the line, "Know when your luck has called you." Well, we certainly knew that luck had called us and had been kind. This experience is very rare and extreme, and I wouldn't like anyone to be unduly concerned that this could happen to them. But I do feel that it illustrates very graphically the importance of developing relationships with those who are charged with looking after us. It takes a little effort and time, but in our case, it was certainly worth it. I think that it is only fair in conclusion to mention the stars in this little drama. Our GP was Dr. Alan Scherer, the hospital was Leicester Royal Infirmary, and the consultant was Dr. Ben Kennedy. Thank you for listening.